My name is Dr. Jonathan Little, and I'm an assistant professor in the School of Health and Exercise Science. And this is my lab, which is called the Exercise Metabolism and Inflammation Laboratory. So this is a clinical chemistry analyzer. We would use this on a regular basis. It essentially can measure anything you can think of in the blood. So we measure metabolites like glucose or fatty acids, as well as hormones like insulin. And the students love this machine because there's a little robot in there that will do all the pipetting for them. So you load up your blood samples, load up the reagents, set up the assay and press go, and you come back a couple hours later and you get your results. So we're broadly interested in the links between type 2 diabetes, inflammation, and exercise. So we know that people with type 2 diabetes have chronic low-grade inflammation, and it seems to drive a lot of the pathology that comes along with that disease. And exercise can be anti-inflammatory. So we put those two things together to see how exercise impacts inflammation in people with type 2 diabetes, and then whether that will improve their cardiovascular and metabolic health. And this area right here would just be the main area in the lab. We use techniques like Western blotting. We run ELISAs a lot to look at some inflammatory markers, and we have a qPCR machine to look at gene expression. So this is where all the pipetting and all the day-to-day runnings of the lab would go on. So I have one research technician who works in here full-time, and she supports the day-to-day running and operation of the lab. And then all the grad students and some of the undergrad students are involved. I tend to have students get involved both in the wet lab, running experiments and analyses in here, as well as in our human physiology lab, so they can see both sides of the research process. They can interact with the participants, supervise exercise, make some measurements there, and then they bring the blood samples up here and they can do the detailed cellular and molecular analysis, so they get to see both sides of that translational research perspective. And this is our most favorite piece of lab equipment. It's called a flow cytometer. It allows us to phenotype, or essentially tell the behavior and the characteristics of all the different white blood cells in our blood. So you can stain the blood with different markers, and you run it through here and it tells you how inflamed or how healthy the cells are. Graduate students from health and exercise science typically come to me or come to this lab with very little to no experience in a wet lab, because we don't have biochemistry type classes in wet labs in our program, and that's totally fine. We can get people trained up to be very proficient in the wet lab very quickly. I think that's something that we're very good at. So we have undergraduate students who might come in to do a practicum experience. We've had undergraduate medical students come in, and they can get up to speed, be running their own assays in the lab within a few weeks to a few months. We've got a biosafety cabinet where we can culture and process blood samples, an incubator where we can culture cells for up to several days, up to several weeks, a fancy microscope to image and view the cells, allows us to capture pictures of the cells at different states. Diabetes is on the rise, as probably most people know, and about 90 to 95% of diabetes cases are type 2 diabetes. So that used to be called adult onset diabetes. Now we don't tend to call it that because we see in some areas that even children are getting this. And type 2 diabetes, we believe, is largely a preventable disease. So it's largely mediated by lifestyle factors, and obesity is the number one risk factor. And there's 2 to 3 million people in Canada right now that have type 2 diabetes, and that number is expected to grow. And one thing that we're really interested in is the people who are at risk for diabetes but don't yet have it. And there's probably 6 or 7 million people in Canada that have pre-diabetes. And those are the people we like to target with lifestyle interventions, because there's very good evidence that if they can stick to a lifestyle intervention, we can prevent type 2 diabetes and all of the costly complications. All right, and this is the human physiology lab. So this is where the individuals would perform the exercise training and we would obtain the blood samples. So we have some standard exercise equipment. For all of our testing, we have a metabolic cart here, so individuals would ride the bike. We can measure their oxygen uptake, their carbon dioxide output, their metabolic rate. We can tell if they're burning carbohydrates or fat. We have some more exercise equipment here. And then in the back room, this is where we would do any of our blood samples, put in intravenous catheters, or do any medical procedures in here. and then the blood samples go up to the wet lab where we perform all the analysis. Well, I can remember the day when I decided I wanted to be a researcher. I was an undergraduate student working in an exercise lab as a summer student. I was on a summer research assistantship, and we had our first lab meeting, and I sat there and we had a project that was all lined up that I was going to work on, and for whatever reasons it fell through at the very last minute, but we had all of these participants we had recruited to be in the study. So we had to quickly design a new study that we could do right then and there. And just sitting there and seeing how you develop a research question, come up with a hypothesis, how are we going to test this hypothesis, it just clicked for me right there that I said, this is what I want to do, this is the coolest thing that you could be doing. So I really think that the career in research is exactly that. You get to ask your own interesting questions, obviously within some constraints, and then go ahead and answer them. So for someone who's inquisitive and someone who wants to know the answers to things, it's essentially the perfect job.